Hello again. A new study of the COVID-19 pandemic shows a higher mortality rate among Asian, Black and Hispanic people than in whites. The study, published in the Global Health Journal, was led by cardiologists from the University of Cape Town. Some interesting key findings from this research. Let's discuss them now with Professor Sliwa. She's one of the principal researchers of the study and the director of the Cape Heart Institute at UCT. Prof. Sliwa, good afternoon. Very fascinating kind of research. I haven't had time, of course, to read all of the research, but when was this done?
Thank you very much to give me an opportunity to speak briefly about the study. So we planned the study in 2020 when COVID was sort of described and discovered. And at that time, I was president of the World Heart Federation, which is a large umbrella organization involving more than 100 cardiac societies. And we started the study because even now, only 95% of all data on COVID-19 are coming from the global north or higher income countries. And there are very few data from the poorer people in the global south, from people from low and middle income countries. So that was the basis to start a study which really focuses on the population living in those regions and trying to understand if there is a difference in who get more severe COVID disease, because the population is younger in the global south and in many regions of Africa, and to also understand if certain conditions which are common, like let's say in Africa, like rheumatic heart disease, certain heart muscle diseases, if those patients living with the disease get a more severe course of COVID-19 infection. So that's a background while we started the study.
So you found that there is a higher mortality rate. That is more Asian, Black and Hispanic people who tend to die compared to whites due to COVID-19 pandemic.
Yes. So what we have found is that in the study we have more than 5,500 patients, and we found that even if you take the fact away that Europeans are older, or if you take away the certain conditions like if you have diabetes or hypertension, that there was a difference in outcome in the different population groups. And the highest rate of admission and mortalities were Hispanic patients, then actually Asians, then Black Africans, and then Caucasians. So that was one of the main findings of the study.
Was age a factor? Is age a factor that the older you are, in terms of even if you Asian, Black and Hispanic, you're more at risk than an older white person?
Yes, I mean, you're always more at risk if you're above 60. And also men have more risk of severe COVID-19 infection and deaths than women across all population groups.
So what do you hope your research will assist with going forward? What should people take out from this study? How will it be useful?
Yeah, the study, I think, gives a lot of information. So one is that if you live, let's say you are in South Africa and you suffer from conditions like hypertension, diabetes, you are more at risk to get more severe COVID-19 infections and also other flu-like illnesses. So it's very important to first know that your blood pressure is high, secondly, to take your medication and to take also your diabetic medication. That's the key lessons for all patients who have COVID. But also the other lessons is that if you have other conditions like you have other heart muscle diseases, rheumatic heart disease, you're born with a heart problem, you must still come to hospital and see your doctors, because we had many patients who were scared to come to hospital. But this is not necessary. It's important to come and to seek help, because otherwise you have a risk to get complications for not managing your other heart problems well.
Yeah, very brief. So when you look at the COVID-19 deaths that have been reported in South Africa, you would say that the majority of them were from Black people, and your study confirms that.
Yes. It's also, you see, we have in South Africa and Africa, there are many places where you don't have enough ventilators, you don't have high flow oxygen, you don't have enough specialists like respiratory specialists, cardiologists. So all this, it's long distance for some people getting to a hospital. They can't afford the transport. So there are many reasons why, unfortunately, poorer people and people from certain regions have not such a good outcome when they have severe COVID infection.
Yeah, poverty plays a role indeed. Thank you very much for your time. Yes, this hour. That's Professor Karen Sliwa, Director of the Cape Heart Institute at UCT.